One of the biggest challenges for the government is not only providing affordable health care, but quality health care. Many questions have been raised, including beds availability, drug shortage, failing equipment, rundown physical conditions of hospitals, and my guess in the capacity as a doctor, not for any company, not any part of the government, but in his capacity as a urologist, agreed to be here this morning to exchange some ideas in those areas. Dr. Philip Ayoung-Chee, thank you so much for coming in.
Hey, good morning, Dr. Rennie, and good morning to the public.
I have for a long time been following the work you've been doing and the views you've been espousing, trying to get the direction set straight for health for the citizenry of Trinidad and Tobago. Working conditions is a sore area, very sore, in Arima, in Port of Spain, in San Fernando, where you were for a long time. How bad really is the physical condition at our nation's hospitals, doctor?
It's very difficult to say anything negative, but I must say, from your experience, living in the United States, conditions are bad. It can be improved. The question now is that we do not have the will. And to put it in perspective, I want to go to a report that was written, the Global Competitive Report 2015-2016. And 50% of our problems, as far as this report is concerned, is our poor work ethic, corruption, and inefficient government bureaucracy. And that will always be a problem. The question of how do we get around it? And what I've noticed over since 95 to now is that ministers are getting around it by going around the problem, which is some members of the public will complain, they will issue a check to this person, they go to private institution and get it done. Okay, so the problem within the service never changes, it doesn't improve. What happens therefore is that you go to the hospital, you're not going to get the service. If you complain to the minister, you may get a check, go to a private institution.
Well, it is scandalous what we have happening here vis-a-vis the expansion of these private medical centers. But we're going to get to that in a minute. I'm just trying to get folks to understand that very often we hear how difficult it is at the institution, and unless you've been there, you don't know. You are working and have worked in them, and I wanted to get a feel as to how bad it is, the nurses and doctor shortage, personnel shortage. How bad is the nursing shortage to the best of your knowledge? How bad is it really? Because, we hear about so many nurses being turned out and so on, and yet we keep hearing of shortages there. We hear of shortages of doctors.
Yes, the situation is that we need more doctors and we need more nurses. The problem with this is basically twofold. One is finance, and one is giving them the working conditions that will attract them. Financially, our salaries are at most pathetic. We can look at all the comparisons with, for example, the professions within the public service, the legal profession, the teaching professions. We are way behind. All right, I can give you an example. A house officer who is the basic junior doctor, the workforce of the whole hospital. In 2015, they are being paid $13,800 a month. Now, when you look at a similar range, for example, range 56 in education, health department technical, in 2014, they received a salary of $17,180. And if you want to go lower to the legal profession in range 55, State Council 3, they're getting $22,000. Okay, so what you're going to find now is that, yes, we are graduating. Right now, I think they're paying for over 300 doctors to be trained this year. Okay, what's going to happen is that you're going to train them. I'm not too sure whether there are jobs with all 300 of them per year, but they're going to sign up and do their foreign exams, and they're going to fly out. Because when you look at the salaries that they're going to attract, for example, the United States, right, it's close to the same equivalent that they get in TT.
Right.
So we are basically training doctors
to export,
not to stay in the system. And I was very much taken aback when I read a report recently, I think this week, where the Minister of Health has already gone back to the Cuban ambassador to start saying, listen, we want doctors and nurses.
You're saying that we are turning them out here adequately qualified, but we are not able to keep them because of the compensation.
One is compensation. Two, we are not putting things in position to attract them. I'll give you another example. In the nursing profession, for example, we are short-staffed.
Yes.
Terribly in this.
And I just want to make a point on that because particularly in that area, what is it? The World Health Organization has said that you need a ratio of 1 nurse to 6 patients. In many parts of Trinidad and Tobago, it's 1 nurse to 20 patients, which means that the whole question of care is down the tubes. Just wanted to make that big because I found that most astonishing.
Well, I'm happy that you mentioned it. So I'll not belabor that point. But the problem here is that when a nurse works overtime, that nurse is not compensated enough. That nurse is told, we'll give you time off at some future period. If a nurse does a double shift because somebody doesn't come out, that nurse doesn't get paid overtime. That nurse said, we'll give you 2 days off. So what happens basically is that you're always backtracking.
Always shortage too.
And there's always shortage. So there's no mechanism in place, as I said, to attract workers. And I keep saying, if somebody works overtime, and nurses are hard working, especially ones who do the overtime, pay them at an overtime rate. All right? And there's a law for payment of overtime rates. It's no magic formula. There's a law.
Right.
So if they do overtime, calculate the overtime rate and pay them. So that the next day they'll come out to work rather than get 2 days off.
Yes, and then you have...
it's a disincentive.
Yes, and then you make that problem even worse. Now, instead of 1 nurse to the ridiculous 20, you can have it up to 30 because you've got somebody who's getting time off to compensate for overtime that did before.
Right, so we always keep backtracking.
You made a mention a moment ago to foreign personnel, being attracted here, medical professionals. And there has been the problem that I met when I got in here. The first thing I heard is that, when the foreign medical personnel are brought in here, they receive better wages and better conditions than the locals.
Well, I mean, that is what I don't know. I don't know how to explain that. You understand? In addition to that, they also get housing allowance.
Yes.
All right. So you are creating a system whereby foreign persons get benefits that locals don't. Okay, I mean, we just went through a situation where we were a few months back, 2 months ago, we were being paid 2008 salaries. Okay, so as I say, you need to put things in place to get people back into the hospital system. Be looking at equipment, be looking at administration, I'm looking at salaries.
That whole equipment thing is another discussion. Listeners, in case you just joined us, the voice you're hearing is that of Dr. Philip Ayoung-Chee, urologist, appearing in his private capacity, not speaking on behalf of any organization. But throughout the years, I've seen the work he's done, and he's been advocating for the citizenry that we get better conditions all around. And I found him a worthwhile person, as he's proving to be here, to identify and speak to some of the problems we're having. In the case you say where we have those folks coming in, are they being done as a transition, or is being done because, as you said, we're training and then the brain drain takes place, they leave, so we end up with the shortage? The folks that we are bringing in, are they any more competent? Are they any more experienced than the people we are training here to say that we have no choice but to bring them in because of the advanced knowledge they have?
Well, the situation really is not at the junior level, but at the senior level. Okay? There is no system in place for people to be given scholarships or to be encouraged to go away. Okay, I can give you my personal situation. To this date, I have asked and I have not received 1 cent to do any postgraduate thing. Okay, I have not gotten 1 cent. So anything that I have done in my life, postgraduate, I have done on my own. Okay, I've used my own money, used my own time, not even days off. Use your own vacation to go on courses, to go to conferences, and you're not compensated for it. Okay, so these are all these incentives, as opposed to when I was in England. If I had to go to an exam or a course, I applied, and I was given that time.
But what kind of response you get from the MPTT, the Medical Practitioners Association, your association? What kind of response are we getting from them? Because they are supposed to look at these common sense issues and demand something be done.
Well,
My
yes,
intent is not to put
I
you
mean,
on the spot. I'm
no,
just
no,
trying
no,
to understand what is the explanation we're hearing for this.
As I say, I mean, as you said at the beginning, I'm here to give you an honest answer. We were in negotiation, and we proposed certain things on the table. And to my surprise, the response was, "Did you sign a contract to do this work?" And we said, "Yes." "Was this provided at that point in time?" And we said, "No." And the response on the other side was that if you signed the contract and it wasn't there, you cannot come now and demand to have it. So I said, "Well, isn't this negotiation? Is this how you negotiate on the other side?" And the person said, "Well, you signed a contract and this wasn't in place. So don't come today in negotiation and demand that you want to put it in place." So I said, "Thank you very much. I mean, that's how you're going to negotiate. I mean,
There's no
what's the purpose?"
negotiation.
You understand? For example, one of the things I would like to have is a proper doctor's lounge in hospitals.
Proper doctors.
Lounge. A lounge.
A lounge, yes.
Where you could sit down and relax.
And exchange ideas and talk
right.
about things and just debrief, as it were.
And the person said, "Well, why do you want that?" So I said, "Well, we are in hospital 24 hours a day."
This discussion you were having, you were in what capacity at that time?
I was on the trade union side,
Okay.
negotiating. This is official negotiation. And the person said, "Well, why do you want that?" So I said, "Well, shouldn't we have a lounge where you can sit down, have a cup of coffee, a television to watch, a chair to sit down on?" He said, "No, you don't need that." Right? Something as basic as that.
Yes, yes.
All right. So when you start going to the nitty-gritties now, it gets even worse. And I think the problem is, and I keep saying it, unless the public stands up and say, "Listen, we are supposed to get a certain level of health care. Why are we not getting it?"
And that is precisely why I asked
And the
you
public,
here, so we can start
and
identifying.
the public is not doing it.
Well, they're not aware of some of the things.
No, they are aware
that you
because
think they are?
They are aware because they are fully aware that recently there's something called the External Patient Plan program where you can't get something in hospital, you write the minister, you get a check.
Yes.
So they're aware of it. But they are not demanding that we put the infrastructure in the hospital so that it's a continuous service.
I'm slightly at variance with you on that, and I understand your passion, but I'm slightly at variance because I believe that the citizenry is not as inside baseball as you are. Inside baseball is the term to say, you in the industry, you are a doctor, you are a urologist, you were on the negotiating side for the trade union, you understand what the problems are. I think the public generally here, they go in, they get bad service, to come out, the perception is that's the worst place to go, that's it. And I'm trying to bring clear to people some of the problems that you hard workers, you healthcare providers have to deal with every day. And that's why we're trying to expose it here. The shortage of doctors is something that I am still not too clear on, because are we saying then that the private institutions are taking all of them? First of all, you said half of them going away after we've trained them.
That's right.
All right. And the expansion we see of private hospitals, how does that undermine the public hospitals as far as availability of doctors and their time? Because some folks come in, punch in the clock for 2 hours, and they're gone. They go into their private practice. I mean, what goes on here? Why is it that we have such in addition to what you stated, why else do we have this competition going on between the public hospitals and the private hospitals?
Well, again, I mean, I go back to the World Report. Poor work ethic in the labor force and inefficient government bureaucracy. Somebody has to manage the system. So you create a management that's not managing. So therefore, all hell breaks loose.
Which speaks to the nepotism that we've heard that happens with folks on their tenure and folks who are promoted. Is that what you speak to?
In terms of promotion within the medical field, the answer is no, really, because to get promotion, you have to do postgraduate training and specialist training. And that's the only way you're going to get promotions. It's not like I'm competing with you. If I don't have the qualification, I'm not going to get the job. All right? And there's so few of us that more or less, if you want to get your qualification, you're going to get a job. But the health service hasn't really expanded with the times. Okay? I mean, over the last 30 years, we have not expanded to grow with our population. I mean, 30 years ago, the service was inefficient. And today, with our expanded population, we have the same service that has not grown. So we're going to remain inefficient.
Technologically, how are we? How are we with technology? Because I keep hearing of new equipment being bought, but then it breaks down. It's not working, and that frustrates the efforts of the best health providers you can find. Speak to that, if you will, please.
Well, they do buy equipment, not enough, I must say. They have not really been keeping up with the times. The system is so bureaucratic that it takes years to get a service going. I remember working, I'm not going to call the place, where I started working in November 2009, and I was told I'd be going to get a new CT scan machine. It was only recently started in September 2015. Okay? And within that last 6 years, that piece of equipment continually broke down. All right. So there's no plan to put things in place to have a continuous service. You gotta wait until it's dead before we do anything to put corrections.
Dr. Philip Ayoung-Chee is my guest. You're saying on the one hand, if I get you clear, the shortage of doctors in the hospitals, a result of us not doing enough to keep them here. We're training them, we're turning them out, we're not keeping them here. In the case of the nurses, what we're doing is that we have a shortage, but those we have, we are working them way over time and giving them time off. And of course, healthcare suffers because they are trying to tend to too many people. The money is being pumped into it all the time. Are you saying it is not money, but just administration?
The money is being pumped in. The question is where. Okay. For example, I always say, I keep hearing that people can write the minister, and the minister has enough money, can give you a check to get things done privately. But when you ask for equipment in the hospitals, you're told there's no money. So there is money. All right. And I hope this present government minister is listening, that he was not going to go through the same routine that has been taking place in 1995, where people write the minister, we have private waiting list initiatives, we have private this, we have private this. And when we ask for services within the hospital, we are not getting it. And then we have to beg, and then we have to cry, and we have to grovel. And then maybe we might see it. But not many of us are going to beg and cry and grovel. We're just going to leave it as it is.
You're listening to Brunch on 107.7. Let's deal with the elephant in the room. And that elephant, Dr. Ayoung-Chee, is the scandalous situation where many feel medical capitalists are masquerading as doctors, whispering in the ears of patients that they should attend private hospitals. This addresses the expansion of the private healthcare providers, very costly and out of the hands of John Public, really. Many feel it is the source of the shortage of doctors and the continued deterioration of the public service. Do you agree with that?
The answer is yes, and the answer is no.
Please.
The health service basically has not expanded. The last major work done in the health service was Eric Williams Medical Sciences Complex in 1980. And it was only opened about 10 years ago to the public. Okay. In 1992, we decided to go to get advice from some foreign consultants. And despite an increase in population then, they told us that we had too much staff and we had too much facilities. So they asked us to cut back on staff. They closed down, they wanted to close down Point 14 Hospital, they closed down the Sipario Hospital, they closed down the Princestown Hospital, they closed down the Miaro Hospital, they closed down the Arima Hospital. Okay? And since then, nothing major has taken place, apart from opening up of Eric Williams, which was built in 80 and opened up to the public around 2004, 2005. And now we have seen another institution, the Covert Children's Hospital, being opened, and plans to start back the Arima Hospital, start back Point 14 Hospital. So in other words, what was that, 20 years ago, 25 years ago? Rather than expand the system,
you certainly come back to the same point.
Okay? And that is where the problem arose. At that point in time, the problem was there, nobody addressed it. And we have gone through how many administrations since that time? And to this date, nobody's addressing it.
through the eyes of a doctor who is still practicing, one that sat on the negotiating side of the trade union. You have heard many things coming to you. You speak to your colleagues all the time. You've got a new minister of health, and many people are optimistic that there will be a change in the direction for health services in this country. If you had to give him, the new minister of health, a top 3 list that can address the problem of doctors and nurses, I think we have made that clear. But and also make it easier and more workable for the public coming in for help in the public hospitals. What would your top 3 items be?
One, we need proper administration. 2, we need equipment. We need infrastructure of the public hospitals to improve via purchasing of equipment. 3, the salaries of doctors and nurses has to be addressed. Okay, we are training too many doctors, we are training nurses, and we are not seeing it in the system. Okay, we need to find out why they are not there, because health is a people-oriented something, and if we're not going to get it, we're going to be in problems. And as you said, one nurse cannot treat 23 patients.
Yes, and doctors, what is the sort of ratio the doctors are operating under right now? The doctors, they're overburdened, you say?
I don't think at this point in time you can say we are overburdened.
You're not, okay.
Because there are not even enough services that we are providing. Okay, we are basically just giving basic services.
Underutilized is what we're saying.
And we are also underutilized.
Dr. Philip Ayoung-Chee, thank you, urologist. Thank you so much for dropping in here with us this morning.